It's been a bit variable, actually, what's happened to stem cell transplantation and CAR T treatment. It has still been happening. So stem cell transplants in many units have been happening almost as normal. Some of the lower risk patients, and that's particularly myeloma patients, have been delayed, and perhaps relapsed follicular lymphoma patients. But again, the curative ones, so relapsed Hodgkin's, relapsed diffuse large B, have still been happening with actually minimal delays. Similarly, for allogeneic transplants, the high risk allos have still been happening at a reasonable pace. CAR T has proven a bit challenging because you do want an availability of intensive care unit beds for that. And some centres have had to pause their CAR T program, but most have now reopened. And even during the height of the pandemic, there was definitely a reduced number of patients being brought to the national panel seeking approval, but there were some. And delivery to those patients was happening. The difficulty I think we faced, although I think this is largely overcome now, was if a patient had been referred to a centre A, let's say, and they'd gone through the approvals, but that centre wasn't able to deliver the CAR T, it wasn't straightforward transferring them to centre B, because there's a lot of bureaucracy. I mean, it's right that it's there. I don't want to sound negative about that, but there's a lot of bureaucracy surrounding CAR Ts, and just transferring patients once they're already in the system is challenging. However, most centres now around the country, thankfully, are up and running, at least to some degree.